Yeah, so hi everyone, and glad to be here today. Perspectives from Iceland, experts, democracy, and COVID-19. So as we all know, policymakers around the world have had to make some very hard choices in the last year to deal with a pandemic. And a lot of these choices have involved trade-offs of various sorts. And in order to understand whether these trade-offs are valid, for example, whether it is rational to lower the mitigation rate of COVID in a certain area by applying a lockdown, we have to sort of look at a host of different issues which can come up from epistemology and applied ethics and philosophy of science to sort of evaluate how these decisions are made and whether they are good ones or bad ones. I think like a good place to start when trying to address this sort of more general concern is just to take a pretty precise look at a case study, and that's what I'm going to try and do today. In particular, I am going to try and get into the sort of nitty-gritty details of how decisions were justified by policymakers in Iceland during the pandemic. So what is interesting about Iceland? Why should we care about what happened in Iceland? First, I'd mentioned that Iceland is a very small country. The population is about 360,000. And what this means is that decision-making processes in Iceland are quite traceable. There was a pretty small number of people sort of fashioning policy in a pretty centralized and streamlined way. And I think if you compare Iceland to much larger countries where you maybe have different regulations in place at the regional or national level, different advisory bodies, different decision-making bodies, things get a bit more complex. But if you look at this sort of very small country where you had a very small number of people making decisions, it sort of removes some clutter. And I think that makes it a nice case to look at. Second, Iceland has quite a low death and infection rate, among the lowest in Europe. And third, there are unusually high levels of trust in top scientists and civil servants, especially the director of health and the chief epidemiologist, who are sort of in charge of the policy response here in Iceland. So they were shown a great deal of trust both from the government, who allowed them to fashion the policy, and as well from the public, who report as high as 90% satisfaction rates with their work. So a little bit of background. The talk today that I am giving is sort of based on prior research, which I carried out last summer in collaboration with a lot of people, which I'd like to thank and are mentioned here. And what we did over this 3-month period was just try and get a sense for how decisions were made in Iceland. And we did this by interviewing key decision makers. So among the people we talked to were the Prime Minister of Iceland, the Minister for Health, the Director for Health, the Chief Epidemiologist, who are these two sort of top scientists I was referring to earlier, as well as the CEO of Decogenetics, which is a private sort of biotech company in Iceland, which was quite influential in the early days of the pandemic. Okay, so here is sort of, I guess, a plan for my talk. First, I just want to give a brief overview of the COVID-19 pandemic in Iceland. I want to talk about sort of just what happened and sort of facts and figures. Next, I want to move on to a philosophical discussion of trust and expertise. In particular, I want to introduce a distinction between epistemic trust and recommendation trust, which is due to Matthew Bennett. He introduces this in a paper from last year, which I think is very nice. And I think this distinction is a good tool for analyzing trust dynamics in pandemic times. Then I'll move on to just sort of an analysis of the decision-making process in Iceland. And I'll argue that one thing that is interesting is that the same group of people, that is the sort of civil servants, top scientists, were shown both great deals of epistemic trust and recommendation trust, and I'll talk about why that might be interesting. Okay, so the first COVID-19 case was logged in Iceland on February 28th, 2020. Since then, we've had about 6,500 infections and 29 deaths. This graph here shows the 14-day incidence rate per 100,000 inhabitants. It gives you, I guess, a sort of general feel for how the pandemic has ebbed and flowed. We have two sort of very large spikes. The first one just in the beginning of sort of March and April in the early days of the pandemic, and another one towards October, and then sort of small bumps up and down here and there. And as you can see, the incidence rate went to almost 300 at its highest point, but has been lower for the majority of last year. It's about 20 right now. Okay, so these are the sort of decisions which were made in Iceland. I think they're very similar to measures enacted in other countries, so maybe it's I shouldn't dwell too much on this. But what could be mentioned is that there were no hard lockdowns in Iceland, and there was no hard policing of pandemic regulations. So although there were quite severe restrictions in place at various points in time, especially when the incidence rate was very high, there was never a total lockdown. People were always pretty much free to be out and about, so long as they complied with regulations like wearing a mask, washing hands, maintaining social distancing, and staying home if sick. And this turned out to work quite well. People were pretty happy to follow this advice. Another thing to mention is random testing. So this was done sort of in addition to testing everyone who reported any symptoms. Sort of at critical moments in the pandemic, there was sort of a random mass testing put out in sort of select sections of society in order to try and understand whether the pandemic was sort of very widespread and whether we were missing a lot of people who were not exhibiting, who did not have any symptoms, but were maybe carrying on the disease nevertheless. Finally, we can mention daily press conferences by the so-called trio, as they became known in Iceland. So on the right, we have Alma Möller, who is the Director of Health. In the middle, we have the Chief Epidemiologist. And on the left, we have Víðir Reynisson, who is a police officer sort of in charge of the emergency planning branch of the police force in Iceland. So what is quite interesting about the Icelandic case is that these three people, not politicians, were the face of the response to the pandemic. So they were hosting daily press conferences for the first few months, which became, I think, weekly as things progressed. They were sort of answering questions about which measures they were considering, how they were justified. They were talking a lot to the press, and sort of the general feel in Iceland is that these were the people in charge, and people were quite happy with this fact. So why these people, as it turns out, there is a legal framework sort of supporting the decision by the government to entrust them for the response. In particular, there are pandemic laws in Iceland, which charge the chief epidemiologist, who is hired by the Director of Health, who is appointed by the Minister for Health, with legal duties to advise the government during outbreaks like COVID-19. And so there was strong consensus within the government to follow this legal framework and heed the advice of the chief epidemiologist and just sort of allow him to be very influential in how policy choices were made, especially in the early days, because as was made clear in interviews we carried out with both politicians and public health officials, in the early days of the pandemic, when there was a lot of uncertainty and a need to act fast, these sorts of legal frameworks sort of facilitated decision-making processes by just carving out pretty clear divisions of labor. Okay, so next I want to move on to this distinction between epistemic trust and recommendation trust. But first, we can maybe briefly think about a common slogan heard throughout the world, which is listen to the experts, or listen to the science, or trust the experts. This is something which has obviously been discussed in a lot of talks in the last couple of days, but this isn't always a straightforward thing to do for policymakers, especially in situations like COVID-19, where there are a host of different perspectives to consider. There are a host of different consequences a decision can have. There's a lot of inductive risk, there's a lot of uncertainty and time pressure. And so although listen to the experts might be a nice sort of starting point, it isn't very informative. And so it might be useful to think a bit more carefully about what it means to trust experts or listen to experts. And something I think you can say immediately is that trust, like expertise, is domain restricted. And so what does this mean? Expertise is domain restricted because we say that an expert is someone who has, more know-how, more understanding, or more knowledge of a specific domain. I mean, I go to the mechanic to fix my car and I go to the dentist to fix my teeth, and not vice versa, because their expertise is restricted to a domain. And so when we talk about trust, we can think about it as a sort of three-part relationship. So X trusts Y for Z. And so if we want to understand how experts are trusted in a pandemic, we can think about the difference between, for example, the public trusting experts or the government trusting experts. And we can think a bit carefully about what it is exactly that we are trusting experts for. What is the Z in this case? And here I think Matthew Bennett's distinction is quite nice. He highlights this difference between what he calls epistemic trust and recommendation trust. So epistemic trust has to do with reliable and factual testimony. I guess it is sort of what we usually think about when we are thinking about what we trust experts for. We are trusting them to use their superior knowledge or understanding or experience to give us reliable information, to sort of have a higher likelihood of making correct inferences within their given domains of expertise, and so on and so forth. Recommendation trust, on the other hand, has to do more with actions and less with propositions. It has to do with heeding advice. So we exhibit recommendation trust when we act upon someone's advice. And Bennett argues that this is a pretty subtle but important distinction, and especially relevant to the COVID-19 pandemic, and I agree. And obviously these concepts are related. I mean, we want the people giving us recommendations to sort of know what they're talking about in an epistemic sense. But what could be pointed out is that in most cases, the threshold for recommendation trust is a bit higher than for epistemic trust, because we both have to believe that the measures being issued are sort of based on sound science, but we also have to believe that they are somehow in our best interests, or perhaps the interests of society. And obviously this is quite relevant when it comes to things like issuing, mask rules for wearing masks, because it isn't enough that people believe that masks are useful. They have to take the extra step of actually wearing them for the policy to do any work. And that's why recommendation trust can be a sort of a useful thing to think about. And what Bennett points out in his article is that we might cultivate recommendation trust and epistemic trust in different ways. Maybe it won't really be the same sort of people who get to enjoy epistemic trust or recommendation trust. And what I want to turn to now is sort of analyze how decisions were made in Iceland. And in particular, I want to point out that it was sort of the same group of people who were shown epistemic trust and recommendation trust. Okay, so this here is a sort of broad overview of just how decisions were enacted in Iceland, just at the sort of legal level. So the Minister for Health enacts pandemic regulations, which are usually valid for 2 weeks at a time. So that's how new rules which dictate what people are allowed and not allowed to do sort of get their legal standing. Sort of, how many people are allowed to gather together, whether you have to wear a mask in certain circumstances or not, etc. These regulations are based on the official advice of the Chief Epidemiologist. As I noted earlier, this is something which is spelled out in pandemic laws, which were pretty much just followed in Iceland. And so the epidemiologist communicates his advice formally via a memo he sends to the Minister for Health, which is then usually made public. And as was the case in Iceland, a lot of these memos were pretty much just adopted into policy without too much change, but more on that later. It should also be noted that there is this branch of the police, the Civil Protection and Emergency Management Unit, which was in charge of sort of implementing regulations, monitoring whether they were being followed, and communicating to the general public what was and what was not allowed at a given point in the pandemic, although this was always done sort of in accordance with, for example, the Chief Epidemiologist and the Director of Health. Okay, so trust. Multiple surveys indicate that over 90% of the general public in Iceland trusts the judgment of public health officials like the Chief Epidemiologist and the Director of Health. It's a pretty staggering number, and I think it can partly be explained by these daily press conferences, which people seem to take very well to in Iceland. So they were held, yes, daily at the beginning of the pandemic for a few months, usually broadcasted at the exact same time. People grew sort of accustomed to tuning into them, and they would see an update. They would see what was being considered, what sort of future measures were being considered. And there would always be a sort of period where the press could ask them about, everything. And people seem to like this a lot, and I think it explains this high level of trust. When we look at trust from the government to these public health experts, both the Prime Minister and the Minister for Health answered the question of whether they trusted the Chief Epidemiologist in interviews with us. It's a very forceful yes, which is perhaps not surprising, seeing as a lot of his advice and his colleagues' advice has been more or less directly adopted as policy. And okay, so how does the Chief Epidemiologist advise the Minister for Health in Iceland? These are sort of 8 factors which are listed in a public memo explaining how this process works. The bottom line in all of the regulations put into place in Iceland was to defend the infrastructure of the healthcare system. And this is a theme you see throughout the pandemic. Most of these factors have to do with assessing the risk inherent in the pandemic at a given situation and assessing how capable the healthcare system is of coping with that risk. And the #1 priority was always to make sure that the healthcare system was in a good situation to deal with it. What is quite interesting to note is this 8th factor, which is social impact and believability of regulations. So the Chief Epidemiologist was quite concerned with making sure that regulations were not too strict as to cause unnecessary discomfort, and to make sure that they were believable, which means that to make sure that people actually followed them and wanted to follow them. This is obviously a pretty delicate thing to balance, especially when you consider that the various socio-economic consequences of these decisions do not fall within the domain of expertise of these public health officials who are doctors and epidemiologists. As the Director of Health says here in an interview with us, when asked whether they performed detailed analysis of the socioeconomic consequences pandemic measures might have, she says, no, that is not a role. That is the minister's job. Our decisions are made exclusively from the perspectives of public health. Others must weigh the importance of different perspectives and interests. So what she is saying is that although they did consider the various consequences public health measures could have, and they did their best to try and fashion them in a way that did not impact people's lives in too much of a negative way, it was just still not within their strict domain of expertise. This leads to the question of, well, how did they evaluate this then in this 8th factor of the advice in this 8th factor of list of factors grounding advice towards the Minister of Health? The answer is that although on the surface of things it might seem as if the chief epidemiologist and the director of health were sort of calling all of the shots in the pandemic, the reality was that the decisions were intensely collaborative. So as the Prime Minister says here in an interview with us, the memos do not spring from the void and onto the government's desk. Rather, they are the outcome of constant conversations between the government and public health officials. And the chief epidemiologist agrees here in saying, larger decisions are always collaborative. I speak with the Minister for Health on the phone maybe 4, 5, 6 times a day. Very, very busy man. More on collaboration here. What happened as well was that there was intense levels of collaboration before the pandemic hit, before the crisis arose. And this was done through creating sort of response plans, which guided early actions to a very great extent. And as Þórólfur Guðnason, the chief epidemiologist, says here in an interview with us, these response plans involved collaborations between 60 and 70 government institutions. Every collaborator has a pre-specified role to play when the plan is then enacted. They know what to do, they know what everyone else is doing, and they know who to work with. It's a bit like a game of football. You have 11 players on the field and they all know what is expected of them when the game starts. Okay.
So back to flag your time there.
Oh, sorry, I'll wrap up very quickly. Yeah. Okay, just to wrap up, recommendation trust in Iceland. The general public showed the chief epidemiologist and other public health experts recommendation trust. How is this achieved? Recall that Bennett argues, and I agree, that it requires a sort of something extra compared to epistemic trust. And the way this was achieved, I have argued, is that they first explicitly appealed to the societal impacts of pandemic regulations. They collaborated extensively with politicians and institutional partners who could maybe aid them in making certain new judgments, setting certain parameters for what is acceptable or not acceptable. And finally, by trying to create an environment of transparency and constant information flow via these daily press conferences. So just finally, those are my concluding remarks. And I just want to end on the note that despite what many people in Iceland have said, at least I do not think this case is an argument in favor of technocracy ruled by experts, precisely because even in this particular situation where it seemed to work quite well to give a select group of experts a lot of power, the only way recommendation trust was really facilitated was through extensive collaboration with elected officials and with the general public. So yeah, I think that's it for me, and I'll turn it over to Q&A.